Hello friends, welcome to the Medico Learner. In this video, we discuss about constipation. For complete understanding about the constipation, we must have some basic idea about normal physiology of the defecation. Then we discuss constipation in the following heading. First we discuss definition, then cause of the constipation, then its clinical feature, then its diagnosis, then treatment of the constipation, and the pharmacological action of the laxative, which is drug for the treatment of the constipation. So what is the defecation? The defecation is defined as evacuation of the bowel through the anus or anal canal, and it is a reflux process. So what is the reflux process? Reflux process is easily understood by a simple example. When someone prick needle unconsciously on our hand, then we suddenly unconsciously take back our hand. It is the best example for the reflux process. In this example, the needle is act as a stimulation, and that gives stimulation to the spinal cord through the sensory neuron, and according that stimulation, the spinal cord is give motor impulse through the motor neuron up to the reactor organ or motor neuron of the muscle, so that we can take back our hand. As same as the defecation is the reflux process. So how that defecation reflux is initiated, or how desire for defecation is occurring? For that we must understand some basic concept. Here it is a large intestine, which is a continuation of the small intestine through the ileocecal valve. That large intestine is have ascending part, transverse part, descending part, sigmoid part, rectum and anal canal. In the rectum and anal canal, at the anal side, there is the presence of the two sphincter, internal anal sphincter and external anal sphincter. That whole large intestine is have 1.5 meter length. In this 1.5 meter length, the first half is related with water and electrolyte absorption, and the second half is have two function. First is the storage of the stool, and the second during the time of the defecation. When that second half is full with the stool, it produce mass movement. So what is the mass movement? Mass movement is mean the whole GI system is have two type of the movement. First is the mixing movement, and the second is the propulsive movement. Mixing movement is mean the GIT is mix the intestinal content to each other. It is called the mixing movement. And the second is the propulsive movement is mean GI content is move in a forward direction. It is called the propulsive movement. So the mass movement is mean it is a specialized propulsive movement in which the 10 to 20 centimeter portion of the large intestine is a contract as a one segment, like that. So that intestinal luminal content is move in a forward direction. Due to that mass movement, the stool content is reach up to the rectum. Here I must clear one point. Normally the rectum is not filled with the stool. It is a filled on the stool. It is filled with the stool only during the time of the defecation. When that stool is come at the rectum, that lead stretching of the rectal wall. So whole rectal wall is formed by the four layer, same as the whole GI mucosa or whole GI wall. First layer is the mucosa, second is the submucosa, third is the muscular layer, and the fourth is the serosa. In the muscular layer, there are the two type of the muscle. First is the circular muscle layer, and the second is the longitudinal muscle layer. in between that muscle layer there is a presence of the one neuronal plexus. It is called the myenteric neuronal plexus. When that stool is produced, stretching of the rectal wall that gives sensory stimulation to that myenteric neuronal plexus, and due to that sensory stimulation it produces the reflex process, and that give motor impulse to the whole large intestine and produce more and more mass movement, and also it give motor impulse of the internal anal sphincter and produce relaxation. It is a receptive relaxation, and yes, it is the first type of the reflex, which is a weak reflex. It is also called intrinsic myenteric defecation reflex. The second is due to the stretching of the rectal wall, it give sensory impulse or parasympathetic sensory impulse to the spinal cord, mostly the S2, S3 and S4 division of the spinal cord. Due to that sensory impulse, it produce motor impulse into the motor neuron, and that give whole large intestine and produce more and more mass movement, and also give motor impulse to the internal anal sphincter and produce more receptive relaxation. At that time the person is have desire for defecation, or person is have thought of go to the washroom. That both reflux is produce desire for defecation. At that time person is have two circumstances. First, person not want defecation because he is in inappropriate condition. That person consciously close their external anal sphincter. The external anal sphincter is controlled by the higher center, which is present into the cerebral cortex. And the person, in the second circumstances, if the person want defecation, that person higher center gives stimulation to abduction nerve, which relaxing external anal sphincter consciously, that lead defecation. Here in the cerebral cortex there is the presence of the higher center, which give stimulation to the abducent nerve, and that relax the external anal sphincter, and the higher center is having a conscious or voluntary control. Now we discuss constipation. Constipation is defined as infrequent passage of hard stool and or patient not have desire for defecation within the 3 days. In this definition there is a one term, it is mean hard stool. Hard stool is indicate there is the absence of water content into the stool. So why that hard stool is formed? Due to that hard and dry stool, it is difficult to move forward direction through the propulsive mass movement. So question is arise, why that hard stool is formed? It is formed due to the two reasons. If the person is not take enough water content or fiber content in their diet, that lead less amount of the water and fiber into the intestinal luminal content, and that produce the constipation. And the second reason is if there is a decrease intestinal motility, that give more time to water and electrolyte absorption, so that the stool is become dry and hard, and that lead constipation. According that both reason we can identify actual cause of the constipation. Now we discuss cause of the constipation. As I said, first is the dietary cause, in which the person is reduced fiber or fluid intake, so that initially the intestinal luminal content is not have enough water content or fiber content, so that produce the constipation. It is the most common cause nowadays for the constipation. The second cause is altered colonic motility due to the neurological dysfunction. For example, diabetic mellitus. Second is the Chang's disease. Chang's disease mean person is have parasite infection, that is called trypanosoma cruzi infection, that lead damage to the myenteric neuronal plexus, that produce that Chang's disease and altered colonic motility, and person is have constipation. The second is Hirschsprung's disease. In that disease, person is congenitally not have myasthenic neuronal plexus, so that baby is also have constipation. The second, then multiple sclerosis, chronic idiopathic intestinal pseudo obstruction, spinal cord injury, and central nervous system injury. Then third cause is drug induced constipation. Commonly used drug is anticholinergic drugs. As you know, the whole GI system is stimulated by the acetylcholine, and their receptor is the cholinergic receptor. When we use anticholinergic drug that block that receptor, and the acetylcholine is not work, so that decrease intestinal motility and that produce constipation. The second drug is opiate, then aluminum and calcium based antacid, then calcium channel blocker, then iron supplement, and sucralfate is also produce the constipation. Then some endocrine dysfunction or disorder which also produce the constipation: hypothyroidism, Cushing syndrome, hypokalemia, hypercalcemia, pregnancy, and then mechanical cause such as the colorectal tumor, diverticulitis, hernia, intussusception, that all are identified by physical examination. Then six is the anorectal pain. Due to that pain, person is not have desire for defecation. For example, fissure, hemorrhoid, abscess, malignancy. It is also identified by per rectal examination or physical examination. Then the seven is anxiety or depression also produce the constipation. Now we discuss clinical feature of the constipation. Patient is have sensation of incomplete evacuation, perianal or abdominal discomfort, complaint of the straining during the defecation. Patient is not have desire for defecation within the 3 days. That kind of the complaint patient doing during the time of the OPD. Then we discuss diagnosis of the constipation. Here I must clear the constipation is one kind of the symptom. So that for complete cure of the patient, we must have to diagnose the which type of the cause is produced that constipation. For that diagnosis, we must do that three following point. First, we take history from the patient. In the history of the constipation patient case, it have bowel movement less than 3 times per week, or person is not have desire for defecation within the 3 days. Then second is the consistency of the stool is the hard and the lumpy, excessive straining during the defecation, prolonged defecation time, need support of the perineum or digital anorectal evacuation. Then we do physical or mental examination during the time of the OPD. In this examination, we must check the per rectal bleeding. It may indicate the malignancy. So first must rule out that malignancy or bleeding part. Then if patient is have pain, that pain is due to the fissure or abscess. If the person is have abscess, then it is must refer to the surgeon, anorectal surgeon. Then we do some special investigation. In case of bleeding, rectal bleeding, we can do sigmoidoscopy or colonoscopy, or also we can do some general routine examination or investigation. Now treatment of the constipation. As I said, for complete cure of the patient, we must identify the actual cause. Then we can only cure the patient. But for transient relief to the constipation patient, we use some medication. The medicine which is used for the treatment of the constipation and or the medicine which is promote evacuation of the bowel, it's called the laxative. That laxative is have different action on the intestinal mucosa according to different type. That action are first action, mostly there are the 3 action. The first action is the hydrophilic or osmotic action. in which it maintains water content into the intestinal luminal content so that stool is not become dry and hard. The second action is acting on intestinal mucosa to decrease net water and electrolyte absorption. By that way, we can maintain the intestinal luminal content water amount so that stool is not become dry and hard. And the third is increasing propulsive activity. By the primary action, we can increase propulsive mass movement so that there is a less time to the water and electrolyte absorption so that the stool is have proper water and electrolyte content so it is not become dry and hard. You can see by any of three methods we can maintain water content into the stool and stool is not become dry and hard so that constipation is not occur. Nowadays there are the many kind of the laxative is available. The laxative is divided into the 5 group according to that different action. First one is the purgative. When person is have extreme or several constipation, then we use that purgative. Nowadays there is the less use of that purgative. Example is the castor oil. The second is the bulk laxative. It all the Ayurvedic churn or the isabgol, brain and plant fiber. It is involved in that class. The third class is osmotic bulk laxative. For example, magnesium hydroxide or milk of magnesia. Second is the lactulose. It is nowadays when widely used. Then fourth is the stimulant laxative. In the stimulant laxative, there are the two subtypes. First is the diphenylmethane and the second is anthraquinone. In diphenylmethane, there is example is the bicycodial and sodium picosulfate, and in anthraquinone there is a senna. Nowadays that bicycodial and the sodium picosulfate is also most commonly usable. Then the fifth is lubricant. Example is the liquid paraffin. It is also most commonly usable. In these 5 types of the laxative, some are used singly and some are used as a combination. Now we can see a different condition and treatment of that constipation case. If patient come with acute constipation and person is also have acute discomfort at the abdomen and person is unable to evacuate their rectum, at that time we can use neotomic enema which contain glycerin and sodium chloride. It is give per rectal so that after that given person is have easily evacuation. Then the second condition, if the person is have acute constipation but not have acute discomfort, then we can use different laxative or the combination of the laxative as a tablet form or and syrup form also. First we can use tablet Dulcolax which contain bicycodial 5 milligram per tablet. It take at night 1 tablet at night with plenty of water so that it can maintain the water content into the stool. It is one kind of the stimulant laxative so that it increase intestinal motility. The second is syrup Dufalac which contain lactulose which is a bulk osmotic laxative. It take 15 ml at night with plenty of water. Each 50 ml of the syrup Dufalac is contain 10 milligram of lactulose. Then the third is syrup Cremafin Plus which contain 3 content of the laxative. First one is the magnesium hydroxide, which is the bulk osmotic laxative. Second is the stimulant laxative, sodium picosulfate. And the third is stool softener or the lubricant, liquid paraffin. It is a combination of the many laxative. And one purgative is castor oil also we can use. Remember, first we can only use tablet Dulcolax or syrup Dupalex. Then if it is a not work, then we can use Crimafin Plus, and that Crimafin Plus is also not work, then we can use castor oil. Now we see the third circumstances. In this case, the person is come with the complaint of the constipation and local pain at the anus, and in physical examination we identify person is have fissure at the anus, so that at that time due to that pain person is developed constipation, so that we can use lignocaine ointment or xylocaine 5% ointment, and person is used per rectal after the every defecation, or TDS also, or during the time of the pain. Then we use one antibiotic ampicillin and coxacillin 250 milligram at the BD, and then we use one painkiller Combiplan, which contain paracetamol, and the ibuprofen contained 400 milligram, and paracetamol 325 milligram. If the pain is so severe or due to the perianal abscess, then we can refer that patient to the surgeon. Now, fourth circumstances, if the person is come with habitual or chronic constipation, then we advise the patient to alter their diet and regimen. In the diet, person is more take fruit, bananas, green leafy vegetable, and person is take at least 1 to 2 liter water per day. In the regimen, we advise patient to regular walking, regular sleeping, and regular abdominal muscle exercise. Which type of the exercise? Here I have some picture. The person raise their leg one by one in the following manner. Also person do that exercise. Also person do cycling at a lying position, and also person can do that type of the exercise in the following manner, so that in that all exercise person is doing the abdominal muscle exercise which stimulate intestinal motility, and person is having curing of the constipation. And then if the person is take any drug which produce the constipation, for example, if the person takes any anti-hypertensive drug, any antacid, iron, that kind of the drug is changed, and person is may recover from that constipation. For that chronic constipation or habitual constipation, we can first must use Ayurvedic preparation, for example isabgol powder or Ayurvedic any churan. Then if person is not curable, then we can and only we use allopathic preparation. For example, first we use isabgol, which is Ayurvedic preparation, which is dissolved in the water and then take with plenty of water, which produce evacuation of the bowel or relief from the constipation. In the allopathic preparation is tablet moza, which contain mosapride 5 milligram per tablet. It take daily one. It is promote intestinal motility. It is also used in gastroesophageal reflux disease. The second drug is tablet Genton, which contain itopride 50 milligram per tablet. It is also increase intestinal motility, so that it promote evacuation of the bowel. And then only that all are not work, then we can use Dulcolax suppository, which contain bicycodil 5 mg per tablet. It is used per rectal at morning so that person is have easily evacuation. So friends, it is all about the constipation. Hope you have some basic idea about the constipation. If you know something new from this video, then like that video and press the bell icon and do subscribe the Medico Learner for more and more educative and informative video. Thanks for watching. Keep learning, keep healthy. Thank you.